Polycystic Ovary Syndrome, or PCOS, is actually a pretty common health condition. It affects how a woman's ovaries work. Many women with PCOS have these small, fluid-filled sacs in their ovaries called cysts. Ovaries make hormones like estrogen and progesterone, which control a woman's periods. But with PCOS, the ovaries might not make enough hormones, and this can cause irregular periods or other problems. PCOS is a hormonal disorder, and it affects women during their reproductive years, which is usually between the ages of 15 and 44. It's important to remember that not all women with PCOS will experience every symptom. PCOS is a complex condition, and it really can have a big impact on a woman's life. But there are ways to manage it. With the right treatment and support, women with PCOS can live full and healthy lives. PCOS can cause a variety of symptoms, and honestly, these symptoms can vary quite a bit from woman to woman. Some women may only have a few mild symptoms, while others may have many severe symptoms. One of the most common symptoms of PCOS is irregular periods, which means having fewer periods than normal. Some women with PCOS may go months without having a period, while others may have very heavy periods. Another common symptom of PCOS is excess hair growth, also called hirsutism. Women with PCOS may grow hair on their face, chest, back, or stomach. Acne is another common symptom, and it's caused by the excess androgens. Other symptoms of PCOS can include things like weight gain or difficulty losing weight, thinning hair on the scalp, darkening of the skin on the neck, arms or breasts, skin tags, which are small growths on the skin, and even infertility. The exact cause of PCOS is still unknown, but doctors believe that several factors may play a role. One of the main factors is insulin resistance. Insulin is a hormone that helps your body use glucose for energy, and insulin resistance means your body doesn't use insulin as well as it should. This can lead to high levels of insulin in the blood, and those high insulin levels can cause the ovaries to produce too much testosterone. Another factor that may contribute to PCOS is genetics. PCOS tends to run in families, so if your mother, sister, or another close female relative has PCOS, you're more likely to develop it as well. Hormone imbalances are another contributing factor to PCOS. Women with PCOS often have higher than normal levels of androgens, which are male hormones. While women naturally produce small amounts of androgens, excessive levels can disrupt the menstrual cycle and lead to symptoms like acne and excess hair growth. Finally, chronic low-grade inflammation might also play a role in PCOS. Women with PCOS often have higher levels of inflammation in their body, and this inflammation may contribute to insulin resistance and other PCOS symptoms. Diagnosing PCOS can be tricky. There is no single test for it. Your doctor will ask about your medical history. They'll want to know about your periods and any other symptoms you're having. They will also ask about your family's medical history. Your doctor will give you a physical exam. This will include a pelvic exam. They will check your ovaries for any cysts. But remember, not all women with PCOS have cysts. Your doctor will order blood tests. These tests will check your hormone levels. They will be looking for high levels of androgens. They may also check your glucose levels to see if you have insulin resistance. Your doctor may also order a pelvic ultrasound. This is a painless test that uses sound waves to create images of your ovaries. The ultrasound can show if your ovaries are enlarged or have cysts. If you are diagnosed with PCOS, don't worry. There are many things you can do to manage your symptoms and live a healthy life. There is no cure for PCOS, but there are treatments that can help manage the symptoms. Treatment typically involves a combination of lifestyle changes and medication. One of the most important things you can do is maintain a healthy weight. Losing even a small amount of weight can improve your symptoms. It can also lower your risk of developing other health problems. Your doctor may prescribe birth control pills. These pills can help regulate your periods and reduce androgen levels. They can also help clear up acne. Your doctor may also prescribe anti-androgen medications. Metformin is a medication typically used to treat type 2 diabetes. It can also be helpful for women with PCOS. Metformin can improve insulin sensitivity. This can help lower androgen levels and regulate periods. If you are struggling with infertility, there are treatments that can help you get pregnant. These treatments may include medications to stimulate ovulation or in vitro fertilization, also known as IVF. Finally, it's important to remember that PCOS can take an emotional toll. It's okay to feel overwhelmed or frustrated. Don't hesitate to reach out for support from your loved ones, a therapist, or a support group.